Hello, and welcome to today's Bettenhouse Bites, short Alzheimer's and memory care orientation videos designed to teach caregivers how to help relieve common behavioral symptoms associated with memory loss. These videos are the very ones we use to improve the skills of our own team, and we are proud to share them with family caregivers as well. I'm Brandy Atchison, aka Brandy Bettenhouse, and I've been with the Bettenhouse family since 2017 and am a nationally certified Alzheimer's and dementia care trainer. Remember, most memory loss behaviors or challenges are symptoms, not intentional acts. And just like if it were a physical symptom, our job as caregivers is to relieve pain and provide loving support. Your response can make a meaningful difference and provide real comfort to the senior in your care. And with practice, you will become more skilled and more comfortable in your caregiving, benefiting both you and your loved one. Joining me today is Dr. Figiel. Dr. Figiel is a board-certified psychiatrist and geriatrician in Atlanta, Georgia, and is a locally and nationally renowned expert in the field of geriatric healthcare. He received his medical degree from St. Louis University School of Medicine, and he has treated various medical, psychiatric, and social problems of seniors living in assisted living communities for more than 25 years and has been in practice for more than 40 years. He has graciously volunteered to share his expertise with us today.
Well, the most common question I get asked by far over the past 30 years is what's the difference between dementia and Alzheimer's disease? And very simply, dementia just is a definition, it's not a diagnosis. So dementia just broadly, generally means that as you're getting older, that you're having changes in your cognition, your personality, or your behavior that are noticeably different than how your cognition, personality, and behavior were in your earlier years. So dementia is a change. And what's implied in the definition of dementia, as we get older, we're not supposed to have noticeable changes in our cognition, in our personality, or our behavior, unless there's a clear-cut, reasonable explanation for it. For example, changes in behavior. Your dad likes to golf all the time. If he stops golfing because he's having severe pain from arthritis, that's understandable. But if out of the clear blue sky after 40, 50 years he stops golfing, we want to at least try to understand why that's happening. An example with your mom, if your mom loves going to the hairdresser, playing bridge once a week, or doing volunteer work all of her life, and then all of a sudden isn't doing any of those activities anymore, it's worth exploring why that is. And if there's not a clear-cut, obvious explanation for it, that possibly could be an indicator of dementia. So again, dementia is a change from your normal, healthy, pre-existing behavior, and changes can occur in your cognition, which includes either memory, language skills, visual spatial skills, your attention and concentration, all of the above, and then also changes in your personality. If you've always been a kind person, you should be a kind person when you're 85 years old. If you're a snarly, difficult person your entire life, you should be snarly and difficult to deal with when you get older. And then changes in behavior. So and behavior is, under that implies symptoms of psychiatric symptoms like more anxious, more depressed, more withdrawn, not as interested in your hygiene activities of daily living. So if you see any of those types of changes that are occurring as someone gets older, that means they meet the criteria for a definition of a dementia. One of the criteria that gets bantered around is whether it gets to the point where you're not really able to function and carry on with your job or your ADLs, and that there's a severity criteria sometimes included in the diagnosis of the various types of dementia, but I won't get into that today. But again, so we're looking at various changes in cognition, personality, and behavior. And once again, dementia is not a diagnosis, it's just a definition. So that's very important. So when somebody has dementia, you go through a very comprehensive medical evaluation to see if there's any particular identifiable medical causes for the changes in cognition, personality, or behavior. The most important thing you need to do is start with a brain scan. And the purpose of a brain scan is just to make sure that there's no silent brain tumors. You want to see if someone has a history of silent strokes. But you cannot diagnose any of the various types of dementia, such as Alzheimer's disease, still from a brain scan. The purpose of a brain scan is to rule out underlying medical problems that may be contributing to the decline in the person's cognition, behavior, or personality changes. In addition to the brain scan, the medical workup for dementia includes a comprehensive array of laboratory tests, just your basic tests. You want to look for abnormalities in your sodium, potassium, electrolyte changes, vitamin B12, vitamin D changes. But really, you don't necessarily see any dramatic changes in people's personality or behavior or their cognition, usually with mild, subtle changes in any of those variables, but still you look for it. If someone has a sudden drop or a significant drop in their sodium, that can cause cognitive changes. Also, you want to rule out urinary tract infections in the elderly. That sometimes can lead to behavioral and cognitive changes. You want to check their blood pressure to make sure their blood pressure is not too high, and even more importantly, their blood pressure is not too low. Also, getting back to the medical workup for dementia, you definitely want to check the thyroid. If there's any abnormalities in thyroid, even low thyroid or high hyperthyroidism, that can lead to cognitive or behavioral changes. As you get older, you're not supposed to have noticeable changes in your cognition or your personality or your behavior unless, like I said before, we can really find some logical, identifiable explanation to account for the changes that are observed. You're evaluating a patient for dementia, you always want to have a doctor that has some experience with the elderly, that's comfortable and that's proficient in diagnosing depression in the elderly, because depression can present with all of the above mentioned symptoms of dementia. It can present with behavioral symptoms. Cognitive symptoms are very commonly observed in people who are depressed, and also their personality changes can occur significantly with depression. So that's the general medical workup for dementia. If all of the medical workup comes back normal, then we start looking for specific types of dementia. So again, dementia is not a diagnosis, it's a definition. If the medical workup is normal, then we start looking for particular types of dementia.
Thank you for taking the time to watch this short video. I hope that you found it helpful. Remember, there's no perfection in the caregiving process, so always give yourself grace. You're doing the best you can during a very challenging time. By understanding a few key communication concepts and applying your learning, you'll become increasingly confident in your caregiving. Please, never forget to enlist the help of others if you are having trouble. This includes additional support from Benton House. If you'd like access to more Benton House Bites, our Confident Caregiving Workbook, or other caregiving at home tools, or if you'd like current pricing and availability for adult daycare or residency at one of our communities, please visit our website and contact your community of choice. We are here to serve you. Until then, be blessed in your caregiving journey, and love from your friend, Brandy Benton House, and the entire Benton House family.